Welcome to the How to Be Awesome at Your Job podcast, the show where brilliant professionals share how to sharpen the universal skills required to flourish at work. Enjoy more career fun, wins, meaning, and money with your host, Pete Makaitis.
Hello, and thanks for joining us here for episode 920 with Dr. Noor Ali. I have been thinking about this episode for a long time because I think it just is so important to understand this funky beast called health insurance in the United States in order to evaluate your compensation plan, the compensation plan of a potential job offer, whether or not it's prudent, financially possible for you to leave and start your own thing, to not accidentally spend a ton of money and limit your career options based on this thing, which confuses a lot of folks. And we have got a true expert in the field to clear it up. Heads up, this is based on the United States health insurance system. So if you're not in the US, this won't be immediately applicable to your own financial life, but you might find it interesting to see what us Americans deal with. Like, that's kind of weird. Well, you'll just get a little bit of intriguing insight perhaps on that front. So I wanted to alert you to that. We're talking about US health insurance benefits, making smart choices, evaluating things wisely, and in so doing, ensuring you're not overlooking anything important as you consider job opportunities and perhaps venturing off into your own. So you'll learn 1, how to evaluate the biggest non-salary piece of your compensation. 2, why you shouldn't limit yourself to just your company's health insurance. And 3, what most people overlook when it comes to insurance. So if you want to check out the show notes or the transcript or the links to items that we've referenced, please drop them by awesomeatyourjob.com/EP920. And here is a bit about Noor. Dr. Noor is a Bangladeshi American medical doctor turned health insurance expert from New York City. She currently runs her own health insurance consulting practice out of Tampa, Florida, offering healthcare insurance strategies to female founders all over the nation. But guys, she helps us too. I work with her and she's been fantastic. Dr. Noor is also the founder of Think Like a Woman, a platform designed to amplify the aspirations and ambitions of female founders worldwide. She hosts a highly curated roundtable business networking brunch called the Impresaria Brunch Experience. And when she's not working on managing her current businesses or building her next retail venture, you can find her curled up in bed with a good fiction book. So huge thanks to Dr. Noor for sharing her wisdom with us, and huge thanks to our sponsor, Uplift Desk. I am, in fact, recording these words right now from my beautiful Uplift Desk that I love, although I could just as easily be standing in about 5 seconds, because that's kind of what they're about. And they're also about hooking us up with a 5% discount with the code AWESOME at upliftdesk.com. I use my desk every day when I'm recording the show, prepping the show, and doing just about every work thing. And being able to shift from sitting to standing in seconds is just transformational. I bought an Uplift desk over 5 years ago with my own money and dutifully moved it multiple times when other furniture did not make the cut from home to home. And I just recently got another for my home office. I love the possibility to stand when I want to get the creative or energetic juices flowing a little bit, to spark some more productivity, focus, and alertness, and then sitting down again when I want to shift into a chill vibe. Uplift Desk is super solid. It doesn't wobble, and you can customize it with well over 100 desktop choices and hundreds of accessories. Their configurator on their website is really cool and fun to play around and see what looks great and if the cost works for you quickly and easily. They got free shipping on this big, heavy thing for real, and free returns. Oh yeah, and a 15-year warranty and tremendous customer service. I had some quick exchanges with them and they took care of me awesomely. And I'm not the only one with great experiences. They've got 4.9 Google rating overall amidst thousands of reviews sharing a similar story. They ship the desk faster than I think any piece of online furniture ordered by me has ever been shipped to me. So color me impressed every which way. You can get your own by going to upliftdesk.com and using the code AWESOME for 5% off your order. That's UPLIFT desk.com to get 5% off your entire order with the promo code AWESOME. Now, here's Dr. Noor. Noor, welcome to the How to Be Awesome at Your Job.
Pete, thank you so much for having me. I'm a huge fan of the show, huge fan of the Golden Nugget. So this is a huge opportunity and privilege for me. Thanks.
Oh, thank you. Well, I'm a huge fan of you and all the money you've saved me on health insurance
I
premiums.
like that. Oh,
since
yeah.
we discovered you about a year or two ago. So why don't we get oriented? So you are Dr. Noor Ali. So you're a doctor, but you're not practicing medicine. And instead, you're doing health insurance. What's the story here?
Correct, correct. Yeah, this gets a lot of people. I'm a medical doctor. I trained in my home country in Bangladesh. My background is internal medicine and general surgery. And if you know anything about this tiny little country of Bangladesh, it's very, very low resource. So we got a whole lot of people and not a whole lot of medical practitioners. So I'm actually trained to treat any human from head to toe. So I can do anything from a C-section to a delivery to a general surgery case to a heart attack to a stroke.
All right. But you're not doing that now. Maybe on an airplane, if there's an emergency, you'll be the person.
I'm not doing that now. I know. I've been doing health insurance for about 5 years now, Pete. Now, the process for foreign physicians like myself, if you're familiar, is we don't have to go through medical school again when we come back to the States. We have to pass a series of licensing exams called the USMLE. Now, the first of those series of exams is step one. The content is basic sciences. And at that point in my career, I was a superstar rock star surgeon, and there was a huge disconnect for me. So I studied for about 2 years and I missed it. I failed the test by one question, which was 3 points at the time. And it really put a damper in my career. I went into this deep kind of depression. I lost all sense of professional identity and I didn't really know what to do with myself. And I just needed a win at that time. So on paper, I just looked like a high school graduate, Pete, because I never went to undergrad. I went straight to medical school, this accelerated medical program from high school. So I was struggling to find jobs. And the only opportunity I got was a sales role at this health insurance company. And I just took it because I just needed a win in my life. So that was the connection between going from a clinical career to insurance. But I've been doing it for 5 years and I really made a career for myself.
I'll tell you, it was my producers who found you originally because I was thinking, I want to talk to an expert on health insurance, both for the show and for me. So please find this person. And you won. I mean, like you are a health insurance expert who is also a doctor. And it's funny because those often don't go together because I've had many conversations with doctors. So like, what's the insurance going to do with this? Or how much is this going to cost? Like, oh, boy, I don't know that. That's a tricky one.
Yeah, they don't teach you that in medical school, right? They don't teach you the insurance part.
So you've got both. So it's funny. Health insurance is confusing, even the doctors. And I remember I even took a course in college. It was also with it was David Sino. It was called Personal Wealth Management. And it was a very popular course. It's about managing your money for finance majors, like the personal side of things. And we talked a little bit about health insurance stuff, and it was a little tricky then. But then in practice, I remember I was at a nonprofit board meeting, and we were just taking the steps like, okay, let's really get health insurance like locked in for the employees. And so someone did the research and we had these options. And it was so funny because here we are, these board members who have some pretty cool accomplishments in the world of like finance and like leadership and running things. And all of us are just like, oh boy, I don't know. It's like, I don't know. And so it was striking. So what's going on here, Noor? Are we just dumb or what's going on? Is it super complicated for everybody?
It is because there's so many players in this game, Pete. If we zoom out a little bit and if we would think like, well, why is it so darn complicated and how come other countries have it together and we don't? We've got a capitalist economy. We've got big players in insurance. We've got smaller groups. We've got employers. And then we've got private companies just kind of like making up their own rules and everything. And then in 2008, we have an administration that says, well, let's try to clean it all up. We're going to do the Affordable Care Act and we're going to try to house everything under one federal platform. But that still doesn't eliminate the private sector and all of these key players. So because there's so many people in this mix, it makes it really complicated because you don't know where to start and you don't know where to go.
Okay, that's great. It's not just me and my fellow board members. It's tricky for everyone, including doctors. And it is just because that's the system that we have with all of the different players. So here we are talking from a U.S. context. Tell me, when it comes to U.S. healthcare and health insurance, is there any country that's awesome on every dimension? I've heard that the U.S. flourishes when if something really gnarly happens to you, we've got a whole lot of high-tech, great stuff to give you a good outcome with that. So in that dimension, the U.S. is great on healthcare, but on many other dimensions, we're not so great. How do we stack up and how do you think about that?
Yeah, great question. And it always depends on who you're asking and who you're having the conversation with. I've lived and worked in Australia. I visited the UK, Canada. I have this recurring conversation, and people ask me all the time, well, what is it with US versus other countries? And exactly how do we stack up? And it's always in any situation like this, especially when it comes to healthcare, there's going to be two sides of the coin. And whoever you're asking, their perspective is going to be different. So if we use the example of the Affordable Care Act, I'm going to refer back to this again because that's what is popularly known as, well, that's where you go to get your health insurance, healthcare.gov. Well, it's not designed for everyone, right? If you put the population of America on a graph and you divide it into four quadrants, the population that's winning with the Affordable Care Act is the lower income and chronically ill.
Okay.
If you're higher income or generally healthy, you're not getting a good deal here. So similarly, in other countries, whatever system that they have or they implement, it's going to be great for one population and it's going to alienate another. So the short answer, Pete, is there is no magical solution. There's no one country where 100% of the population is happy. And I don't think that's ever going to happen.
That was my next question, and you answered that lovely. I've heard some people say, oh my gosh, Obamacare, the name also used for the Affordable Care Act, ACA. They say, oh my gosh, this is awesome. It's like, I'm saving so much. And then other people say, this is terrible. My last plan was, I did so much more and I paid less. So there's some strong feelings on both ways, but I think you summarized it rather well. It's like if you're lower income and or chronically ill, you're better off now that the Affordable Care Act exists. And if you're on the other side of that coin, you are personally worse off, but maybe you feel good about how you're contributing to the health of others, or maybe you don't.
That's exactly right, Pete. Exactly.
Yeah. Okay. So thank you. That's that story. Now I want to get into one of the main reasons I wanted to have this conversation, because this topic is different than a lot of our other episodes. I've heard people say many times, oh boy, I'd love to start my own business or do my own thing, go out on my own, but, I'm with this company and they got great health insurance. I really need the health insurance. I've got a family of four, or maybe even someone with a chronic condition within that. And so I guess I got to stay put. To what extent is that assertion accurate versus poppycock versus something in the middle?
I'm going to lean more towards the poppycock for that situation, because that's absolutely not true. Now, historically, traditionally, employers were the best source to get health insurance, because the larger your corporation is, the risk can be diluted more. The actuarial risk can be taken down, and the company can offer greater benefits to their employees. In addition, if the corporation is doing well, they can sponsor more towards your premium. So your out of pocket, what is coming out of your paycheck, looks less and less. So I am not at all denying that you can get excellent health care from your employer and large corporation. However, that is not the only place to get health insurance. There's an entire whole other world out there outside of your employer where you can purchase your own health insurance. And in the specific situation that you stated, Pete, I want to pick that apart a little bit. You mentioned a family of four where one person has different needs than the other. And that's something that I want to, hone in on. It's something that I do for some of my services is let's really analyze that. What is the risk and the needs for each of the person in their family? If only one person out of a family of four has a greater need, the entire family does not need to be on a policy.
Well, actually, Noor, that was the huge insight that you gave that's resulted in my own personal savings. Thank you again for that. Is you say, okay, so you think your wife might get pregnant again. Okay, well, then some plans are really great for that, but they're expensive all the time, versus that you and the other kids could be on this less expensive plan, and then she'd be on a separate. It's like, oh, wow, wait a minute. One family, two different plans. Like it was funny in my brain. It's like, wait, we're still a family, right? It's like,
right.
Like,
yeah, I don't have to divorce my wife for this.
We can still file our taxes jointly, right? I was like, oh, of course. Like, I just never thought of it that way. And so you opened my eyes and some savings. So we'll talk about that. That's cool. So then maybe, I know there's so many different kinds of plans and things change, and this may be out of date in a few months, but just for a snapshot. Okay, here we are, December 2023. Let's say we don't even know the value our employers are giving us or what we'd have to really shoulder if we went out on our own. Can you give us a taste for what does it cost, say, an individual who's, fairly healthy, let's say 40 years old, versus an individual who's not so healthy, 40 years old. We'll do 2 by 2. An individual, a family of 4, healthy, unhealthy, very roughly speaking, what might we expect in the range of monthly premiums if we're shouldering it all on our own for pretty good health insurance?
Okay. Considering that there's no subsidy here, so no ACA government plan subsidy, a full premium price plan for a healthy 40-year-old man can range anywhere from $350 to $450 a month. We can land somewhere right in the middle and say roughly $400 a month.
Now, that sounds low. Are these ACA Affordable Care Act plans healthcare.gov?
It could be. So it depends on what market we're shopping. So if we zoom out a little bit and back up, the starting point when researching a plan for yourself is what market do I shop in? The public healthcare marketplace, which is the ACA Obamacare, or the private healthcare marketplace. So the public healthcare marketplace is entirely income dependent. So that same healthy 40-year-old man, if he makes anywhere between $20,000 to $55,000 a year, he can qualify for a sliding scale subsidy from the government. Will they pay a portion of his premiums? If he does not qualify for that subsidy and exceeds that subsidy qualifying threshold, then his premiums can look anywhere from $350 plus.
Okay, thank you. Now let's get a taste for an unhealthy person. Somebody's like, hey, I got some stuff that I got to deal with, ongoing medications, condition.
So the sad news is no insurance company wants to take on this unhealthy person with all of this stuff, right? Because insurance, even though they're dealing in the business of risk, they don't want to take on that risk. They just want to take your monthly premiums and want you to never use your insurance again. So the best market to shop for someone who has major pre-existing conditions is going to be Obamacare, ACA, public healthcare marketplace, because this is a guaranteed issue platform. They're not going to ask you about those pre-existing conditions. However, I should note that there are degrees of risks and pre-existing conditions. The example that I like to use is an asthmatic. If you got asthma and you've got a little inhaler that you have to use here and there, maybe an albuterol once a day, versus that same 40-year-old man with asthma who is a smoker, overweight, has to go to the emergency room to get nebulized every time he has an asthma attack, are 2 completely different risk profiles. So it's worth assessing that risk profile to see, hey, is my pre-existing condition really as bad as I think it is? Can I still get a plan that's less and, shop for an insurance company that'll take me for insuring me for less?
Okay. Well, in that very unhealthy situation, if they are going on healthcare.gov, are they still in that $350 to $450 range?
Depends on the income. So if the income is $20,000 or less, you can qualify for Medicaid, which is free healthcare in your state. Anything between $20,000 to $55,000 roughly, you can get a sliding scale subsidy, and your plan can be anywhere from $0 up to $350 plus, depending on that subsidy and tax credit.
Okay. And women, do they pay more because of pregnancy and these sorts of issues?
Women pay more just because they're a higher cost to insure. They have a whole set of organs that cost a lot to maintain. So in general, a 40-year-old woman is going to cost more to insure than a 40-year-old man.
And we were saying $350 to $450. What do you think is the woman?
Similar range, but maybe a little higher, depending the deductibles and max out of pockets could be higher. So I would still say maybe these plans for a woman would be starting in the high 300s or 400s.
Okay. So if you have like a family of 4, would I just multiply that number by about 4?
Ish. So children cost less. And there's so many, factors here. I hate that I'm even giving numbers, because if someone hears this and they find there's some inconsistency, that I don't want to be attacked here. Because children are going to cost less to insure, but there's so many variables that go into finding this calculating this monthly premium, right? Zip code, age, risk factors, where you live, the cost of living there, the medications that you take, if we're calculating monthly premiums. But children usually cost anywhere from $75 to $200 monthly premium, depending on age and where they live.
Okay. Well, so this is informative. So just to make things simple, I'm just going to say 500 times 3-ish. So you might call it $1,500-ish of premium per month times 12 months. We might be talking about $18,000-ish of a family's budget, which is potentially more than the rent and or groceries for people if they're on their own. So I think that to the extent of is that statement, I can't leave my job, I got to have the health insurance, real versus poppycock, I think the answer is, well, it may very well be $20,000-ish a year of an issue if the employers paying it all versus not. So that's always been my perspective. It's like, well, hey, if you can clear $20,000 extra doing your own thing, then you might be fine. You just got to take that factor into account, is that health insurance provided by an employer is a real benefit of substantial economic value, but it need not handcuff us.
Right. Correct, Pete. And you mentioned that the employer is paying all of it. There's hardly ever a situation where employer pays all of it. They're paying 50 to 70% of it perhaps, but the rest is coming out of your paycheck. So often people don't pay attention to it, but you are paying for it. You just don't notice it as much.
Thank you. Thank you for sharing that. Okay.
Yeah.
So now, what's open enrollment? We hear a lot about it around this time of year.
Yeah.
And what's the deal?
Yeah. Open enrollment is the time of the year where insurance companies open up their arms and say, come sign up, enroll into our plans for the next year. You can get health insurance now. It's significant because it's a sensitive window. You can only sign up for health insurance on the public healthcare marketplace, typically November and December of every year, for coverage for the following plan year.
Now, what's that about, Noor? Why can't we just buy something whenever we want to buy it?
Because we're going to go back to the concept of risk. Insurance needs to calculate how much risk they're taking on for 2024, do that actuarial analysis and run their numbers and reporting. So if people are signing up all year long and they're not doing any type of pre-existing clause, they're taking on random levels of risk at random levels of the year, an insurance company cannot run its business taking on that risk.
Okay, duly noted. So then if, let's say we got fired or we left our job in the middle of the year, are we just out of luck? We just got to go uninsured until November, December?
No, that would be a special qualifying life event. So there are a series of circumstances where in the middle of the year, if you just decide to, you move, you get married, or you just lose your job or get terminated and have no longer access to benefits, those would qualify you to be able to sign up for a plan on the public healthcare marketplace using the special enrollment period. I do have to point out, though, on the private side, there are no special enrollment periods. You can sign up all year round.
Okay. So I'm also curious to the notion of public versus private and employer sponsored versus individual. I've had the experience, I remember in Chicago, when we made the shift from my wife's health insurance to, okay, I'm getting all the health insurance. There were some plans that I just could not access if I was not associated with an employer, which I thought was wild. It's like, I am willing and ready to pay outrageous amounts for my health insurance premiums. I've already steeled myself for that reality. And then it's just like, oh no, you just can't have that plan that has all the really cool doctors or whatever. And I thought that was so weird. What's the deal with that?
Can you tell me a little bit more about that though before I answer? Where? Yeah.
I think it was something like a Blue Cross, Blue Shield, Gold, or Platinum, Choice, Select. I don't know.
Who said you couldn't have it though? Was it an employer or a group or what?
There was one plan that my wife had, and it was pretty sweet in terms of it had vast numbers of physicians in network and all that. And then as I looked at healthcare.gov, it was just like, no, that's not on the menu.
Yeah. So that's going to be a public versus private market. So the public healthcare marketplace, Obamacare, typically doesn't have PPO networks, which is going to be those higher quality plans that you're talking about. You can only get those when you're part of a big employer, a group plan, or you go on the individual market and you basically get a private insurance plan. So that's one of the biggest detriments of plans on the public healthcare marketplace is they don't have PPO options in most states.
Not a PPO to be had in most states on healthcare.gov. And for those who are not familiar, what do these letters PPO mean?
PPO stands for Preferred Provider Organization. It's pretty much like it sounds. It's a higher quality access for the benefits that you have. So Pete, you can have the most awesome health insurance plan in the world, costs $0, free copays, all that stuff, covers you head to toe. But if you can only see the doctor that's 30 miles away and has availability 6 months later, what good use is that plan? So the network of access to providers, that's what the letters PPO, HMO, EPO stands for, is where and how can you use your benefits of your health insurance policy. And you always want to choose a PPO because that's the higher quality.
Okay, so PPO is the best. Is HMO the worst?
You could say that, yeah.
And what's EPO stand for? What's that do?
Something just in the middle. Exclusive provider organization. It's a mix of HMO and PPO where you can see the doctors you like to, but again, it's a much limited and smaller network.
Okay. And how can I know the network I can access in advance of getting a plan?
Well, when you look at the plan, you'll know what network it's on. But I think that one of the advice that I like to give that's relevant in this situation is it's always better to stay in network with the plan instead of finding a plan around the doctor that you love. Does that make sense? Because just to fit a plan around a provider, you might get really screwed in every other benefit. But if you have a plan that works in terms of benefits for you, then going along with the network and benefits of that plan is going to be more beneficial. But when you're exploring and researching plans, you're always going to know what network that is, whether that's HMO, EPO, or PPO.
I think that's sort of like the tough pill that I guess we just have to swallow, is that if you're fond of 3 distinct doctors in different specialties for, it's like, oh, I want to get a plan that covers all of those. Well,
yeah,
the odds are not in your favor, unfortunately, to pull that off.
Yeah.
Well, although in the case of some private plans for either individuals or corporations, you might have better luck there in terms of like, this is a premium offer that happens to include your 3 favorite specialists in different domains.
Precisely.
Okay, that's good to know. So Noor, if we're young and healthy, do we still need health insurance, or is that a waste of money?
Am I allowed to laugh and scoff in response to that? Okay. I'm laughing and I'm scoffing, but I'm trying to keep it together. Yes, Pete, you absolutely do need health insurance. And the best time to get it is when you are young and healthy, because that's when you are the lowest risk, the most desirable to health insurance companies, and they're willing to insure you for a lot less cost and willing to give you a lot more benefits. So that is the best time to get yourself some good insurance.
Well, yeah, I know someone who was young and healthy, and then she got cancer, and it was so sad and startling and unexpected. And so then she had a heap of medical bills. And so then there was like they were doing like some benefits and some fundraisers and some donations. And someone who was curious and courageous enough to pose the question is like, so did she not have health insurance, or how did these bills kind of end up mounting so high? And then the person said in reply, of course she didn't have health insurance. She's young and healthy. Why would she spend money on health insurance? And so I like that you're presenting the opposite point of view strongly, because that's how I think about health insurance. It's like, would you like to not go bankrupt if something terrible happens to your health? If the answer is yes, and you live in the United States, having health insurance is unfortunately a necessary thing that you need to enjoy that privilege.
Exactly. That is exactly right. Yep, that's exactly it. Mm-hmm. You're absolutely right.
So if we should all have it, tell us, what are some of the clever ways we might go about saving on health insurance?
Yes, great question. I want to offer a little bit of insight on the young and healthy thing, because this is a fallacy that I see a lot in the young and healthy population is, first of all, they think they don't need health insurance. So that's mistake number 1. You absolutely do. But the second thing that I notice is they go for the plan with the lowest premium and the highest deductible, because that just makes sense in their heads that, well, I'm hardly ever go to the doctor and use it. Why would I pay more in premiums? Whatever. So in that situation, what's happening is, let's say you have health insurance for 2 years and finally something happens and you need to use your health insurance plan. You have a $200 a month premium and you have a $10,000 deductible. That's a typical low premium, high deductible plan ratio. So for 2 years, you paid your insurance company $200 a month. And when you finally need health insurance because you got into a car accident or got diagnosed with cancer, you are going to have to pay the first $10,000 of bills before your insurance company is going to step in and pay anything. So you just ensured that in that situation that you are paying, not your insurance company. So that's completely like, the opposite psychology that you should be using as a young, healthy, low risk person when selecting your health insurance plan. The better strategy, in my opinion, is what is the lowest deductible that I can afford with the comfortable premium. And that may be $250, $300, just a little bit more per month. But if and when you need to use your health insurance benefits, you want to make sure that you are spending less out of pocket and your insurance is stepping in with those bigger bills.
Okay. So let's talk about some of these words. This is like everything you want to know about health insurance, but we're afraid to
I
ask.
know.
Premium,
Premium.
deductible,
Mhm.
co-insurance. What do these words mean?
Premium is the amount of money that you have to pay per month just for having your policy. Whether you use it, you never use it, you have to pay the premium. If you work for a big corporation, that's typically divided up into your biweekly paychecks, comes out of a paycheck, but it's traditionally calculated as a monthly premium.
All right. And then what is a deductible?
A deductible is the amount of money that you have to pay in addition to the premium before the insurance will start paying out on your benefits. Now, typically, most insurance plans only offer preventive care before the deductible. Most insurance plans don't offer a whole lot.
Okay. And then what is a co-insurance percentage?
Co-insurance is after you meet that deductible, is the percentage of bills, medical expenses your insurance company will pay.
Okay. So if it's an 80%,
Mhm.
then I'll pay through my deductible. And
Mhm.
then I will still be on the hook for 20% of what happens above and beyond that.
Correct. Until you reach your max out of pocket.
Okay. And so max out of pocket, is that just what it sounds like? Is like, I will not part with any more money than this in a year?
Yes. It's a value that states that once you pay your insurance company this amount, they are obligated to cover the rest of the bills.
And is that in addition to, on top of the premiums?
It's always on top of the premiums. Yes.
Okay. All right. Very cool. And what is a copay?
A copay is very similar to the co-insurance. It's either or. Your plan can either have a copay or a co-insurance. And a copay is a fixed dollar amount that you pay for medical services before the service. So that can be a $20 copay to see a doctor or specialist. So you would pay that before you even see the doctor.
That's good. And what's funny is I've learned from experience that copays are actually good. Like, I want to have like a $50 copay to see a specialist, as opposed to not having one, because then the neurologist might be like, yo, it's actually $450 to talk with me for half an hour. It's like, oh, whoops. I'd rather have a $50 copay. So copays are a good thing that we want to see across a broad array of services. Is that accurate?
I would say in this economy, having a fixed copay is going to be much better than a co-insurance percentage because of the example that you just stated. You want a fixed dollar amount rather than a percentage of a big bill.
Okay, there you go. And then the network tells me who they are willing to give money to. And so if I go out of network, then the plan might specify, well, hey, you have no benefits or fewer benefits. Is that accurate?
Correct. Yes, less benefit. Yeah.
Okay, so we want in network for good savings. And so we should research in advance who is in the network. And sometimes that's harder than you'd think to determine, because there's a lot of, it's like, oh yeah, we take United Healthcare. But United Healthcare has many, many plans underneath this brand name, this company.
Yeah.
So how do you recommend we do great research on getting clear answers on, no, for real, who's in the network, who's not in the network?
Yeah. Well, every insurance plan will have their network directory, but honestly, those are updated every 30 days. Sometimes they're not accurately updated. So the best and fastest way is to call up your doctor that you like, your provider, your hospital, your urgent care, and say, hey, do you guys take this plan? Are you in network? Just ask the question.
Okay, thank you. And that's one of the services you and your team provide, right? You do a little bit of the groundwork, a little bit of the hustle on behalf of your clients, right?
Yes, I do. So if you are a client of mine and you just want to know, hey, where can I go? I'll happily do that for you. I'll give you a list.
Well, and honestly, that is just so huge. I mean, thank you. Because this stuff is so complicated. It makes me groan. So this is part of why it took so long for us to get on the microphone together, is that you do some of that work, and that is awesome. And at no cost. And I'm trying not to be too much of an advertisement for you, but I can't resist. I think you're awesome. So like, I don't have to pay you any extra for that. How on earth is this financially workable for you to do all this legwork and we paid nothing to do it, to have it done?
Yeah, that's a great question. Well, Pete, to be honest, I did raise my prices just a little bit since we worked together, but not a whole lot. Yeah, not a whole lot. But yeah, it's one of the concierge services that I provide. So for all of my clients, things like claims, customer service, I'm happy to do that for the life of the policy because I know how onerous it can be for you and how easy and convenient it is for me. It's not a big deal to me at all. The way I get compensated is through the insurance company that I end up connecting you with. They pay me a portion of your premiums for my commission. So don't worry, I'm taken care of.
That's right. Yes. Well, and so in a way, it's interesting. Like you'll pay the same amount whether we go to healthcare.gov or you, right?
Correct.
And yet, when we go through you, we get these extra benefits and services.
Correct. Yep. Yeah. It's pretty cool.
It is just the healthcare provider or the health insurance provider who has a slightly shrunk profit margin.
Yes.
And I don't mind.
Me neither.
Sorry, health insurers. I think they're doing okay. And then give a little slice to you. So that's win-win-win. Okay. So then tell us, what are some of your favorite tips for saving on health insurance or healthcare expenditure overall?
Well, when it comes to finding and researching your plan, I think doing a needs assessment and risk evaluation is huge. That's really where I start the journey whenever I speak to someone and they come to me asking for, well, where do I even start? So some of the things that I'm going to be looking at is where you live, how much money are you expecting to make, and what is your medical or health risk profile? And because of my strong medical background, it's very easy for me to do that assessment quickly. So once I kind of profile your risk, then we decide, okay, public market, private market. And there's a type of a plan that I specialize in and I advocate for. And it works really beautifully for people in the healthier and wealthier bracket and on the private side. And it's called a medically underwritten health insurance policy. And this model is the pre-2008 or pre-Obamacare era where, if you're generally healthy and you're earning too much to qualify for any government subsidies, we can underwrite you medically into a high quality PPO health insurance plan that's going to last you a lot longer and mirror the quality of a corporate package or, a major medical plan at a fraction of the cost.
That's cool. Okay, so then we've got a great plan. Well, now tell us, how do we work it?
Yeah.
So that we don't have unfortunate, unexpected medical expenses along the way of living and using that plan.
I love it. This is one of my favorite questions to answer because working your insurance plan or milking it is exactly what you should be doing. So the first things to note is make sure you take advantage of all of the preventive care. Insurance companies don't want to spend money. It's more beneficial to them to keep you healthy. And how do we keep you healthy? Go to the doctor at least once a year, get your preventive, your annual wellness and checkup. So you're not, surprised with cancer because that's what's going to cost them. And that's all they care about. So take advantage of all the wellness and preventive benefits that your plan has at the very least. Then if you need to use your plan for services, start at the lowest tier, which is going to be virtual therapy and care. That is very accessible to you. You can do it from home. Now they have trained physicians that they're designed to send prescriptions to your nearest pharmacy without you leaving or doing anything. And they're billing at a lot lower rates. So don't go running to the emergency room for a cough and cold, stomach ache, or UTI, your yeast infection. For women, start with a virtual visit. That's going to save you tons of money. It's very convenient and it's going to help on the insurance back end.
Okay. And one of the other cool benefits of insurance, I can't believe I said that sentence, a cool benefit. Okay, but I said it. I believe it. When you get medical bills, the explanation of benefits statements, it'll show you, okay, hey, normally we charge this much money for the services, but because, you have this insurance, we've pre-negotiated a rate between them. And so now it's discounted and then your benefits cover this amount. So it's sort of like we knock it down from, $500 if you had nothing to, okay, $320 because we pre-negotiated to, and you have some insurance benefits. So then you might be left with like $80 or something at the end. So that's kind of cool. But what can be tricky is, do they call it balance billing? Is like, oh yeah, I am on the hook for a little bit after everything. And oops, it's more than I thought it would be. How do I prevent that from happening?
What I know about balance billing is that it's just difficult to predict unless you request estimates or, hey, tell me exactly what you're going to bill to insurance. And that involves communications with the billing department before you seek services, which can be challenging in emergency situations. So I don't have an actual answer of what to do after the fact.
Certainly. So after the fact, good luck. But what you can do to prevent that is ideally You talk to them, you get the estimate. And I've heard that even if you do get that surprise, you could ask and say, hey, I was really surprised to see this, given that you're a network and I see the insurance paid this. So like, what can you do for me? And sometimes they'll just, oh yeah, cut it in half.
Yes.
Just like that this happens.
That's a great strategy, actually. And negotiation is something that should never be left off of the table. Now, typically, negotiation is a strategy that's used for cash pay patients, people who don't have insurance. They say, hey, I wasn't expecting this much. What can you do? And you always want to offer cash because facilities would always rather be paid upfront immediately than wait 30 to 90 days for a claim to process and for insurance to pay them. But now we've seen it working also with insurance. If you can combine having insurance and still negotiating and repricing down your patient responsibility, you can't do better than that. That's amazing.
Certainly. And that also having that estimate in advance is huge for your negotiations. Like, hey, wait a minute, you said it was going to be this. Like, oh yeah, but we also had to do an ultrasound. It's like, well, why wasn't that on the original estimate? It's like, oh, we didn't click the CPT code for an ultrasound. And the estimate is like, well, I didn't know I was supposed to do this. Like, okay, fair enough. Just knock off $300. Like, okay, just like that. So when it comes to pricing it, the way I think about options, or how do you think about what I've narrowed it down to a few options of plans. I kind of like to play with the numbers and say, okay, if I use no health insurance, how much cash would I be out over the course of a year? If I had a horrific accident, shattering dozens of bones, multiple surgeries, how much would I be out the year? So like the out-of-pocket plus the premiums is basically, and all that. And then what do I really expect to happen? Like, okay, I'm going to go to the doctor a couple times and then maybe check in with this or that. And then I look at sort of like those three total out of my pocket cash amounts across the scenarios and across the options. So it takes a while to make a call. It's like, okay, which plan is really my best option? Oh, that plan doesn't exist next year. Whoops. Do it again. Is this a good way to go, or what's a faster, easier, smarter way to assess the different plans and which one's optimal for me?
That's a fantastic exercise, Pete. And I wish that, more people were more savvy like you to do that determination. The quicker, faster, dirtier way would be to call me and I do that for you. But
all right, thank you.
Yeah, if you've got the skills, go the Pete route. But if you don't and, you're below average, then you can give me a call.
Well, I would say for all my savvy, I've still made mistakes and had unexpected medical expenses. Oops. So learning those lessons. Well, tell us any other tips, tricks, things to do or not do when we're buying or using our health insurance.
Yeah, really just take some time to get to know your policy. Some really high level things you got to know about your health insurance is the monthly premium. How much are you paying just to have your plan? Your deductible, your max out of pocket, and really cool, special little things. And that's a very personal thing to find out. If you love going to the chiropractor, really know your chiropractic benefits, right? If you've got a kid who's active in sports, what is your accidental policy like? How much is it going to cost if your kid's going to, break a leg? So know those common situations and scenarios that's important to you. Understand what that out-of-pocket liability is going to be. And if you don't know those answers, reach out to the person that helped you get your plan. They'll have those answers, and just have a mental note on that. I'd also say to do, pretty frequent assessments and evaluations, even if it's not every year. If you have a major life change, that's a good time to evaluate your health insurance policy. Is it still working for me? If you're having a baby, that's an important time. If you have a move or a life change, that's an important time. But also if new products come out on the market pretty often. So understanding, am I paying the lowest that I can pay? Are there any new products out there that's going to be a better fit for my needs?
That's great. And tell us, what about these so-called health share programs like Liberty Health Share, Samaritan Ministries? How should I think about those?
Yeah, that's going to depend on a lot of things. So I'll tell you my opinion on health sharing plans. So the first thing to understand is they're not true insurance products. So it's not insurance at all. And the value of insurance is going to be that max out of pocket, that clearly defined number that says, hey, I give my insurance card this. Worst case scenario, cancer, all bones shattered. This is the most I'm going to pay. Don't ask me any more questions. That's the contract between you and your insurance company. So that's one thing that I find to be lacking in most health sharing plans. And the second factor that impacts a lot of people is many health sharing plans are based on faith, which requires some lifestyle commitments that not everybody's prepared to commit to. So if it aligns with your lifestyle and you're okay with that model, that's fine. The third thing I'll say about health sharing plans is it's very non-traditional. It's a healthcare alternative. It's certainly trending. But if you come from a corporate background where you're used to a traditional healthcare model with fixed copays, where you don't have to negotiate for or do any type of self-advocacy or patient advocacy, you might not like that model because there's a lot of standing up for yourself, paying first, and then negotiating and repricing down, and then hoping that your health sharing plan kind of kicks in with the rest of the bills.
That's what I've heard. I guess my personal take is I know friends who've had great experiences. Like some, I think it was a premature child, and just, that's a nightmare. And them saying, well, hey, we're here for you in your time of need, sir, and this is your time of need. And he just starts crying and like just feeling super supported by them. It's like, wow, great. That's really cool. And there are others who say, I don't know if I trust that they're really going to have my back when it's there. And yes, there could be some faith things that, may or may not jive with your, values, beliefs, wisdom, tradition, lifestyle stuff. So there's that. What do we think about vision, dental, these kinds of health insurance matters?
This depends on your level of usage. If you don't go get your eyes checked once a year, or you don't wear glasses or contacts, do you really need vision insurance? No, probably not. If you are using eye care and you actually buy glasses and materials, I think there's value in vision insurance. Similarly for dental, if you're just going in for cleanings twice a year, you could probably be better off paying for that out of pocket at your local dentist. One strategy I can advise is if you're open to a dentist, anytime a new dentist office pops up, they offer an introductory rate for cleanings and preventive care. Do a cash pay, take advantage of that. Where dental insurance really has value is if you have horrible teeth that require continuous work, like root canals, bridges, fillings over and over again. Those services are billed at much higher rates, and it's valuable to have an insurance plan to take care of most of the bill versus you doing cash pay.
Oh, that's good to know. So the negotiated rates between dental insurers and dentists are much better than the cash rates. Although a lot of dental plans I've seen, it seems like their maximum coverage is a little skimpy. It's like, man, if things really hit the fan with my teeth for tens of thousands of dollars, you wouldn't really have my back to that level. Unlike, out-of-pocket maximums with health insurance. It's like shatter 20 bones. Okay, they've got a hefty bill and I don't so much. And with the vision, I've learned that sometimes with vision insurance, you think, oh, I get a free pair of glasses, whatever. But then if you buy glasses from an optometrist office, somehow all the lenses and somehow even with the insurance benefits, it ends up being way more than buying them on like Zenni Optical or Warby Parker or some of these other places. So you may be better off cash paying for your eye exam, getting a valid prescription, and then just going to buy your glasses online and forgetting a vision insurance benefit. That's just my own experience. Is that something you've observed within your clientele as well?
Yes. And it depends on, again, the billing practices, where you live, how much they're charging for those frames. All of those factors go into it. But I would say if you are looking to stretch your benefits, more, that strategy that you said is pretty great. Go get your eyes checked and get a prescription and then shop around on an online provider to get it for less.
Okay. I read a juicy story about a health insurance provider using AI to deny a bunch of claims and getting into some trouble. And some lawyers mentioned a factoid, which I thought was intriguing, which said that only 0.2% of people appeal a health insurance denial. Is that accurate? Or do you know? And or what are odds of success if the health insurer says no and we say, no, really, yes?
This is really interesting. I don't have data to back up what I'm going to say, but I'll share my personal experience. I would say that factoid sounds right because, I would say that people don't appeal it. However, my clients, I am absolutely tenacious when it comes to things like that. If an insurance company is denying a claim, I am so fast to appeal that claim before the denial letter even comes through. That's also a service that I provide and I like to do. And in my experience, what has happened that in that claims denial and appeal process, the bill from the hospital or the emergency room or whatever somehow disappears. because nobody wants to deal with that process. Insurance company doesn't want to reopen the case and, reassess, and the facility or the hospital writes that off as a lost expense because they say, okay, well, and we're never going to get paid for this because our patient is not paying us and the insurance hasn't paid us. So we're just going to file this away as an expense. So it actually works out if you actually appeal.
Okay. And you'll do it for us. So
yeah, exactly.
That's easy.
Yeah.
Cool. All right. Noor, wow, what a whirlwind. Any final thoughts before we hear about some of your favorite things?
No, this has been a fantastic conversation. Thank you for your questions today, Pete.
Well, thank you. Well, now could you share with us a favorite quote, something you find inspiring?
Yes, a favorite quote. I use this across every aspect of my life is by one of my favorite authors, Haruki Murakami. And he says, if you read what everyone else is reading, you'll think what everyone else is thinking.
Oh, that's good. Well, speaking of what everyone's reading, what's a favorite book of yours?
Good one. Okay. The Midnight Library.
Ooh. And a favorite habit?
Gratitude with every step, with every breath, active, intentional gratitude.
Okay. And is there a key thing that you share with clients that they repeat frequently? They quote Dr. Noor often on?
I'm going to pull something from my desk that's for another business that I have for my company, Think Like a Woman. And I have my quote here. And my quote is, there's nothing more powerful than an ambitious woman aligned with her aspirations. It's from one of my companies.
Okay. And if folks want to learn more or get in touch, where would you point them?
My website, drnoorhealth.com, DRNOOR health.com. What's more entertaining is following me on Instagram because you can see my entire life unfold in stories. It's quite entertaining.
Okay. And you have a final challenge or call to action for folks looking to be awesome at their jobs?
If you want to be awesome at your job, take a look at your health insurance benefits. Pay attention to what is coming out of your paycheck. If you are curious, if you can do better, give me a call, talk to me, and let's see what we can do for you.
Sure thing. Dr. Norris, has been a treat. I wish you much luck and success in all your adventures.
Thank you. Thank you so much, Pete. Thank you for the opportunity. I love this conversation.
I think one of the most striking things about this conversation is that Dr. Noor and people like her can provide fantastic service, which I've experienced firsthand, and at zero cost. So if you're in the position of getting your own health insurance plan, or just taking a look around to see if maybe you want to do something other than what your company offers, then I think it just makes all the sense in the world to work with an advisor like Dr. Noor and not do it directly on your own, because it can be overwhelming and you don't have the extra support resources. It's just free. It's just good. And I do have an affiliate relationship with Dr. Noor, but I hired her before I did. So I'm a true believer. So I recommend you reach out and get some input from her if that's something you need with that free 15-minute consultation. The show notes, the transcript, the links to items that we've referenced are found at awesomeatyourjob.com/EP920. I hope to catch you next time, and peace.
Thanks for listening. To get the most out of the show, we recommend 2 key things. First, check out the extra resources at awesomeatyourjob.com. You can find this episode's transcript and links, as well as the perfect episode for your situation. You can search the full text transcripts of hundreds of episodes or explore episodes tagged by topic and competency covered. Second, subscribe to the podcast and get future episodes automatically. You can subscribe by telling Siri and several other smartphones and speakers, subscribe to the How to Be Awesome at Your Job podcast, or by tapping subscribe in your podcast player of choice. If you'd like some extra help figuring out podcasts and how subscriptions work, visit awesomeatyourjob.com/subscribe for guidance. Hope to catch you on the next episode of How to Be Awesome at Your Job.
Look around. You can find cars like these on AutoTrader. New cars, used cars, electric cars, maybe even flying cars. Okay, no flying cars, but as soon as they get invented, they'll be on AutoTrader. Just you wait. AutoTrader.